Okay. Good morning, everyone, and welcome to the Coopen Summit, the international event dedicated to the Coopen Initiative, a project of innovation for development that is promoted by Fondazione Cariplo and Fondazione Compagnia di San Paolo, two of the largest Italian foundations of banking origins. My name is Nick Martin, and I will be your MC for the day. Uh, Coopen is a participatory open innovation process for implementing impactful solutions between Italy and Africa by facilitating partnerships between Italian NGOs and Italian African innovators. Coopen took actions in 3 areas of interest within 3 relevant SDGs, Sustainable Development Goals. Those are food and sustainable agriculture, health and well-being, and circular economy. And today we're going to be talking about health and well-being, SDG 3. The project are carried out under the Coopen Initiative. They could be implemented in 8 African countries: Ethiopia, Kenya, Rwanda, Uganda in East Africa, and Burkina Faso, Mali, Niger, Senegal, and West Africa. So today, we are going to meet the teams that develop projects within SDG 3, Health and Well-being. The Coopen Initiative is managed by Cariplo Factory in cooperation with the aforementioned foundations, with the collaboration of Tiresia Research Group of the Milan Politecnico University that supports Coopen projects for monitoring and evaluation initiatives, and our partners at JengaLab and Effecinque. Again, I mentioned I'm Nick Martin. I run an organization called Tech Change. We're in the business of building beautiful online courses and events on topics that matter. And we have a whole team at Tech Change dedicated to digital health capacity building and convening. So this particular topic, health and innovation, is very near and dear to my heart. So now I'm going to ask my colleagues to show the agenda of the day, and then I'm going to talk a bit about explaining the platform that we are all using today, Coopen. So you can see we have, after we speak, we'll have a bit more conversation. We'll have a roundtable. We will do the project presentations. There'll be opportunities for question and answer. We'll have a keynote speech, and then another project presentation, another Q&A session, and a keynote speech. So lots of conversations and opportunities for you all to engage. I want to talk a bit about the digital platform that we're using today. The platform is very easy. On your left, you can find the different areas of our digital space. You'll see the main stage where I am speaking right here. You will see the reception, the expo area where you can actually explore the projects that will be presented today. Inside the expo, you can also find one-pagers for the projects to better discover and understand various details. And listen, if you find one or more projects interesting, the goal here is for you to connect with projects. So if you find them interesting, connect with them, contact them. The email contacts are in fact listed inside the one-pagers. On the right-hand side, you will find that you have a chat where you can contact the other guests and ask for one-to-one meetings. We also have a poll area where we will interact with you by asking some questions and the Q&A. So to warm up, I would love to invite you all to check out the first poll here. You can find the question on the right-hand side. The question is, how much is your organization involved in projects related to healthcare and innovation? And there are a number of different options for you to answer. So throughout the day, we'll be quickly referencing some of that data coming back at us from your answers. As I mentioned, during the day, we'll have 2 Q&A sessions after the project presentations. So if you have any questions, please do not hesitate to write us in the chat. So I'm going to introduce the Coopen Summit partners, and then I'm going to introduce our first speaker. Okay, so the first partner is Fondazione Cariplo. Fondazione Cariplo is a philanthropic organization leveraging its financial and human resources, as well as the planning and assistance capabilities it has to promote and back endeavors pursuing the common good and aiding individuals in fulfilling their potential. Fondazione Cariplo operates through 4 philanthropic areas: arts, culture, environment, scientific research, and social services, and has 9 strategic goals. Fondazione Compagnia di San Paolo. Fondazione Compagnia di San Paolo, FCSP, was established for philanthropic purposes to promote cultural, social, and economic development on the strength of its assets and heritage. The foundation pursues 3 goals: culture, people, and planet, and has 14 different missions. And lastly, the Cariplo Factory. They are a benefit corporation, open innovation hub of the Fondazione Cariplo. And they activate a talent chain that includes open innovation projects and internationalization support activities with a commitment to create positive social impact for the benefit of the community. So now I have the great privilege of introducing Cristina Toscano, the program leader in the Fondazione Cariplo, and she is going to talk about the Innovazione per lo Sviluppo. Cristina, over to you.
Hi, Nick. Thank you very much. And thank you to all the people who are joining us tomorrow. I'm actually the project leader of Innovazione per lo Sviluppo, Innovation for Development, the project that is led by Fondazione Cariplo and Fondazione Compagnia di San Paolo. So I'm representing here both foundations because both foundations have decided since 2016 to join ideas, forces, strengths to work in the field of international cooperation, targeting technology innovation processes. The idea was to have a space to address problems related to vulnerable countries and populations with an approach that could be able to include innovative solutions, products and products. Processes and products. So the main axis the program has been working were 3 challenges: open innovation, capacity building, and events. Under the challenges pillar, we find the Coopen initiative that has brilliantly been introduced by Nick. So I will just add few information later. Under the capacity building pillar, we have supported a variety of training sessions, a variety in terms of content and models to build an ideal community that could share hybrid skills. And then under the third pillar, we put strengths on organizing events and support networking online and offline to exchange best practices and ideas. So this is our way of working, and this is Coopen. Coopen has been already presented by Martin, but I just wanted to show you what has been the model design together with the partners. The innovation flux foresees 4 steps: build, challenge, test, and execute. Under the build axis, there have been a call for interest to select civil society organization and work with them and their communities on the ground to select challenges that have been taken to the innovators, the community of innovators, a global community of innovators, opening calls in the 3 areas that Martin has already presented: circular economy, food and sustainable agriculture, good health and well-being. Then we have been doing and going to the third axis, that is test. So the partnership that has been developed between civil society organization and innovators had the possibility to create a space for collaboration and have a funding for planning and development. There also been the possibility to incubate and accelerate the product developed under the partnership. And then the final phase has been mentoring and achievements, the execute phase. It means taking the project to the ground and launching the product or the model to the target markets. So these are the numbers of Coopen, 20 projects initiated and supported, 34 Italian civil society organizations involved in the program, and more than 360 submissions received from innovators, so ideas from more than 20 countries around the world. So it's a huge movement that has been created all around. And the overall resources dedicated to this first initiative, to this first model, has been almost 2 million euros. The 2 days event aims to promote the solutions developed to disseminate the knowledge and best practices acquired through the experience. And also it's really an opportunity to exchange among you and exchange among partners and practices that has addressed health and well-being. So I really thank all the partners, Cariplo Factory, JengaLab, Tech Change, and all the speakers that will be inspiring us, and all the solutions that will, the project that will present themselves. I really thank everybody for their willingness to contribute to grounding in the innovation in Africa with us. And I really hope that after this event, we will be able to continue the discussion and the dialogue. So I thank you very much. I leave the floor back to Nick, and I think you can follow us up until the end of the event, because a lot of thoughts, I think, will be given up to the end. Thanks a lot.
Christina, we thank you so much for your remarks. Thank you so much for kicking us off here today. And now I have the great privilege of introducing a dear friend, Paola Fava, who's the ICT expert at JengaLab, and she will be introducing the speakers we have for our roundtable. Paola, over to you.
Thank you, Nick. Thank you so much for the introduction. It's, first of all, a real pleasure to be part of this event as a member of the Coopen team. I've seen this project taking off, and arriving at this stage is really a great privilege, and as well share our learnings with very important speakers is also a real privilege. So you see some faces on the stage, and I actually inviting our guests and the panelists live on the stage. And I would like to start this roundtable with a quick round of introduction. And so I think we can start with ladies first. So I'll ask you as a first round to just say your name, full name, the organization you're working for, and your role within the organization. So we can start with Madison, then followed by Denise, Michele, and then Steve. So over to Madison. Thank you.
Thank you so much. Hi, everyone. My name is Madison Marks, and I'm a portfolio strategist with the UNICEF Venture Fund under the Office of Innovation. Excited to be here.
Thank you, Madison. Maybe Denise?
Hello, good morning, everybody. I'm Denise Piva. I'm a technical officer for Italian Agency for Development Cooperation.
Thank you, Denise. Michele?
Thank you, Paola. It's a pleasure to be here. I'm Michele Di Marco, and I'm an architect specialized in disaster risk reduction, and I'm between the funding team of what we call TECNE, the World Health Organization Technical Science for Health Network. where beside, of course, like working on engineering control for infection disease, I also coordinate the TECNE members' operation and activities.
Great, thank you, Michele. And Steve, over to you.
Sure. Thank you so much. Good morning, good afternoon, good evening to everybody. It's a pleasure to be here. My name is Steve Allis, and I'm a Senior Digital Health Advisor in JSI's Center for Digital Health. And my primary role is as a project director for a project called CHISU, Country Health Information Systems and Data Use. Thank you.
Thank you, Steve. Thank you, everybody. So great. We had this first moment for introducing ourselves, and then let's go a bit deeper into the topic of the roundtable. So I think we are in an interesting situation because we started the Coopen project with actually several roundtables with the civil society organization who took part to the Coopen project, and today we are concluding with the process of Coopen with another roundtable. And so I think it's really show the idea of the participatory approach that we wanted to give to this process and this project. So during the actually initial roundtables between the civil society organization, we tried to define together what are the main challenges that the organization face in terms of healthcare and well-being, and in trying to understand how innovation can help in addressing some of these challenges. Here you have the list of challenges, and I'm just gonna read it out to you a bit. So some of the main challenges that have been identified has been the promotion of training of qualified medical staff and healthcare personnel, having the possibility to have more efficient medical instrument and device that are fit in low resource setting usage. As well, related to this point, also the maintenance of medical equipment and devices and instruments. We have been talking about the challenges of constructing healthcare environments and infrastructure. So we're getting close to what Michele was presenting earlier. Collect and organize clinical data. I think there is a lot to talk about this. Access to treatment and communication, and also prevention activities in local community targeted especially vulnerable groups. So going to the roundtable topic, I'm sure that many of you is familiar with some of these challenges, maybe all of them. And so we would like a bit to understand what is your approach and the approach of your organization in addressing this type of challenges, some of these challenges with innovative solution, technology, but not just only technology. So we can start again, I'll go with ladies first. We can start again with Madison. So as you mentioned, you're a portfolio manager and UNICEF Venture Fund. And so you're daily dealing with innovative solution related to healthcare and health support. So how does UNICEF Innovation Office and the UNICEF Venture Fund approach this objective? How do you identify or select, for example, innovation that can bring benefit within the healthcare background? Thank you.
Sure. Thank you so much for the question, Paola. And I'm going to unfortunately have to turn off my video because my bandwidth isn't great. So that you can hear me clearly, I'm going to say hi and then switch off my camera for the next couple of minutes. But as mentioned, so I work for the UNICEF Office of Innovation, which is headquartered in Stockholm, Sweden. So the goal of UNICEF, what we call OOI, the Office of Innovation, is to discover, co-create, validate, and scale solutions and technologies to deliver for children today and set a new piece of social impact for coming generations. So in terms of our global health priorities, these are around identifying, developing, and scaling up innovative solutions that can meet the demands and challenges for equitable and quality healthcare. So when we look at our areas of focus, we're primarily targeted right now on the following three. One is maternal and child health, the second is immunization, and the third is nutrition. So we have a number of solutions that we bring in from the venture fund perspective. So what's really relevant for the audience we have today is that the venture fund is currently the only way that early stage startups can work with UNICEF in a more formal way. So we have investment of $100,000 either in US dollars or its crypto equivalent to invest in early stage, what we call frontier technologies. Frontier technologies can be AI and data science, blockchain, drones, extended reality. But we invest in these open source frontier technologies to understand their potential implications on children. We have invested in a number of technologies across verticals, but definitely have health as one of the main focuses, both directly and indirectly. So sometimes, for example, in Africa, we have innovations that are looking at building an AI model to detect respiratory diseases in Kenya. But we also have had drone delivery in South Africa for vaccinations. And so with the Venture Fund, we are interested in not only understanding the potential implications of these technologies in the field. We do our best to connect the companies with UNICEF country offices for pilots and partnerships. But we're also really interested in the learnings of the technology itself and how this can play a role for UNICEF country offices, which we're in more than 190 countries. So how can these learnings also translate for UNICEF as these frontier technologies become more and more new and common in our operations? So from our perspective, when we think about innovation, and particularly around open source, our goal is to help our companies that we invest in become what's called digital public goods that can be scaled upon. So looking at really democratizing access to information about the technology, and we really invest in the core infrastructure itself. So in Africa, we've identified a number of challenges that are relevant as you shared. So we've seen challenges with companies not only accessing funding to do the testing, and when you're building let's say, like I'm using the example of a company called Neural Labs in Kenya that I'm working with right now, since they are building an AI model, they need access to partners who can provide support. They need access to data. So as UNICEF, our venture fund has a full suite of mentorship and technical assistance that we provide to the company in real time. So we have mentors on everything from AI and data science to data privacy and security, evidence of impact to help them with their case studies, business strategy. So we're trying to target a holistic perspective when it comes to supporting these external innovations, which we then try to see have a space within UNICEF. And then we support their growth when there is a match with the country office for a pilot. But even along the way, we see these companies struggle with access to data, privacy and security, securing partnerships that are long-term, capacity building. So but also dealing with the shortage of qualified healthcare professionals, accessing rural communities and last mile health, limited medical supplies, and of course, high costs with deployment. So from our perspective, we're seeing this across the board with particularly early stage companies working with UNICEF as a whole. But when we think about scaling health innovations, there are so many different priority areas that are emerging from different country contexts. So in some countries you have more humanitarian contexts, and in others it's more developed. And so the needs are very diverse. And so from the UNICEF Venture Fund, we're in touch with our colleagues who are closest to the problems at hand. And then when we put out calls for applications to startups for the Venture Fund, we try to match those solutions that we're bringing in with the problems that have been identified, so that we have the best chance of really seeing the potential of these technologies tested in the field. I'll also say, because I'm sure startups will be curious to know how they can benefit, but we do have open calls for applications at different times of the year. So the UNICEF Venture Fund is really the gateway, and we for innovation externally, but also for advising across the organization in terms of how to bring in these emerging technologies and how they can impact children. As I said, indirectly and indirectly, whether it's drones delivering vaccines or whether it's, a direct AI model that's used to help provide more efficient outcomes or solutions. So that wraps up my overview. I'm happy to answer any questions.
Thank you, Madison. That's great. I think you gave a really very interesting, you share very interesting points with us. I find it also very interesting, the component of the UNICEF fund to try to capitalize on the different innovation that you have been experiencing, and so try then maybe to promote them across different situation and conditions. Thank you for this great overview. Maybe then over now to Denise, so we continue on the ladies' side. And so Denise, would you like maybe to tell us a bit about the approach instead used by the Italian Agency for Cooperation and Development in identifying projects and solutions, particularly the one that are using an innovative component to tackle some of the healthcare challenges. And also, if you have some example, as Madison also mentioned, or some examples to share with us, that would be great. Over to you, Denise. Thank you.
Thank you. Do I have to turn off the camera?
No, I think we can clear you. We can hear you clearly. There's no delay. So please, you can leave the camera on. Thank you.
Okay. Well, health sector has always been among the priority areas of intervention of the Italian Agency for Development Cooperation. Alongside other funding channels, our agency invests in this sector both through specific public comparative procedures such as the Global Fund calls aimed at defeating diseases such as HIV, malaria, and tuberculosis, and through call for proposal open to CSOs, local authorities, and Italian enterprises, which I will discuss from now on. It must be pointed out that, with the exception of the Global Fund, so far the comparative procedures for development initiatives are not sectoral, but rather are open to project proposals in a set of sectors and SDGs targets defined from time to time. Regarding CSOs and local government calls, proposal selection is based on evaluation criteria such as outcome, strategic effectiveness, sustainability, and the impact the initiative is expected to have. Technological innovation is not a requirement in our calls for proposals, yet it is introduced by the proposing subjects themselves, mostly through partnership with for-profit subjects. First of all, it's important to highlight that a large number of initiatives aimed at supporting local health facilities include ITC management application for medical records management, along with training for staff. Among the technological innovation that have been introduced in healthcare and to promote inclusion funded by the agency, I have to mention the crucial role of telemedicine solution developed in Peru and Bolivia with the initiative Health and Telemedicine, consolidating and strengthening access to primary health care in Peru and Bolivia, in order to ensure health care, especially for communities living in the more distant mountain areas. The introduction of health equipment for screening of communicable diseases in different African countries, but also a new software talking about inclusion and disability created by an Italian startup that enables real-time transcription of words into letters, making it possible for students to read the teacher's explanation in real time from any electronic device. This last innovation has been introduced in vocational schools in Ethiopia with the project name I Lead, promoting job employment through accessible education and digitalization, directed at the inclusion of children with hearing loss through inclusive educational materials. Technological innovation in health sector is supported in partner countries also through agency for profit calls, whereby business initiatives that are innovative, sustainable, and inclusive are selected and co-financed. In these initiatives, the introduction of new technologies is always accompanied by the training of health workers and biotechnologists. Among the for-profit initiatives, I would like to mention the project Technical and Commercial Synergy for the Dissemination of Portable Radiological Systems in Cameroon, with which mobile equipment suitable for reaching the most fragile and marginalized individuals has been disseminated, without the need for physical transportation at a lower cost, with a strategy that includes ongoing training of radiologists and technical and radiological technicians, equipment maintenance, and training in maintenance of biomedical engineers. But also the initiative Support Health Value for Palestine, Integrated Health 4.0 services in orthopedics and rehabilitation, which aims to provide the Palestinian physician with innovative tools for remote monitoring and rehabilitation of patients with lower limb trauma and with respiratory and cardiovascular diseases, transferring know-how through the emotion device. These are only a few examples of the initiatives that our agency invests in. Our experience shows that the technology transfer carries broad risks in terms of sustainability, risks that can be mitigated by a careful analysis of the context, of the presence or the absence of trained human resources able to use and maintain such technological devices and facilities. But above all, the financial capacity of local actors to maintain them over time. By the way, we found that a strategic partnership between different actors with different purposes, for example, institutional, no-profit, for-profit, works as a favorable outcome to be always encouraged and enhanced by donors.
Thank you, Denise. I think it was extremely interesting to hear about a possibility that IX gives in terms of promoting projects that have an innovative component, but not only. And also, it's I think from what you have said, you can clearly see how all the challenges that we have mentioned above are very much interconnected because I think many of the projects that you mentioned don't respond just to one of them, but they cover definitely quite a few of them. So thank you for sharing your experience and inputs on this. I'm now going over to the next with the next panelist, Michele. So Michele, as you mentioned, you're part of the technique group at the WHO. And so your office responds to requests from supporting countries in terms of construction of healthcare environments and infrastructures. Within our some of the projects that Coopen supported, we have actually projects also related to this aspect. So it would be very interesting to know a bit how your team work in terms of implementing innovative solution on this topic and on this challenge. Thank you.
Thank you, Paola. To better answer your question, I think it's important to mention the journey that the Technical Science for Health Network, better known as TECHNE, had, like in a relatively new area within the WHO, the World Health Organization. So internally, we like to say that TECHNE born by a virus that was developed by a frontline needs and that materialized as a core program within the WHO at the beginning of the 2020, at really the beginning of the pandemic. So basically, TECHNE is a network that is composed of universities, institutions, humanitarian and international organizations that work in collaboration under WHO leadership to develop technical intervention. And these technical interventions are at the service, of course, of Ministry of Health, other UN agencies, and big international organizations. The network is composed by people and institutions that have inside different background, different technical background, from the background in architecture, engineering, epidemiologies, and of course public health. But at the beginning, when we started to discuss, even within the WHO and of course with other UN agencies, like the need and of the connection between the building environment sector and the health sector, everyone was a bit, like, why that? And that is basically because at the beginning of the 2020, health ministry and different facilities across the whole WHO region were looking for evidence-based guidance. And but at the same time, it's really practical recommendation on how to make health setting and structure safer for both the healthcare worker, the patient, and of course the community that was surrounding these facilities. So the requests were mainly focusing on the redesign, the patient and staff flow. Of course, when talking about infectious disease, are extremely important. The setup of triage, screening area, treatments, quarantine in a very diverse setting, from Italy to Burkina Faso to Australia, Brazil, India, etc., all over the world. So in response to that, WHO decided to reach out to the relevant specialists, university and institution that had this multidisciplinary backgrounds inside, that were able to share this technical expertise, connecting health, building, design, and engineering discipline. Of course, Tecne is collaborating very closely with other WHO departments and with several other UNH international organizations. At the moment, I'm in Paris because we are actually looking at innovation projects together with UNICEF and MSF. So Tecne, we can say that Tecne activities have to be faster, so have to be delivered in a time manner, have to be smoother, so have to be, of course, well coordinated and inclusive of all relative discipline, and to be fairer, so have to be carried out in equitable way for all. And for that reason, we are pushing a lot into the what we call fair knowledge and knowledge sharing. And of course, we are based our activities and our approach on what we call smarter framework. So the activity have to be specific, meaningful, achievable, relevant, time-bound, and there to be the possibility to be evaluated and readjusted if needed. And they have to be louder. So have to be clearly and widely communicated. And that's extremely important when you want to share something like both internally of our organization within the humanitarian community, but of course, directly to the community, the local community, the Minister of Health, etc. So our activities over the past 3 years, so it's a quite young, let's say, area, group like within the World Health Organization, have included different kind of services that are ranging from the ad hoc technical country support. For example, Ministry of Burkina Faso, let's talk about now, Ministry of Guinea Equatorial, there is a Marburg outbreak. So the Minister of Health is asking support on how to set up a Marburg treatment center. So together with our technical network, we are supporting them on the design, on the management of these facilities. At the beginning, it was, of course, just about COVID, because we were born, by a virus, as mentioned before, like through the COVID-19. But after expanded to other infection disease, and more recently also supporting the Ukraine crisis and the earthquake in Syria and Turkey. I just want to mention one project that I think is quite relevant, also because it's including the main humanitarian agencies and different Minister of Health and local community. So following the G20 in Italy, that was focused on the role of logistics in the current and future health emergency, in 2021, WFP and WHO launched the Initiative initiative, actually. So this joint initiative is bridging together emergency actor, researcher, and academic institutions, and of course, international and national partner, to promote knowledge sharing and skill transfer to improve emergency response to health crisis. So Initiate2 will develop, it's already started, like standardized innovative solution, such as, for example, the first one that will be finalized hopefully this year, like a disease-specific field facilities, and of course the different kit that will be tested in the UNHRD base in Brindisi in Italy, and all in different places all over the world. That it's included WHO, WFP, UNICEF, ALIMA, MSF, and many other like international. They actually sit together around a table to discuss what were the challenges and how we can solve challenges through innovative solutions. So the goal for the next 5 years of TECHNE, to conclude, is to have at least one TECHNE member in each of the 194 countries that are part of the WHO family. So that in the case, a Minister of Health is needed to prepare or to respond to an health emergency, they already have inside their country like one TECHNE member that can respond or prepare to an health emergency, but at the same time will respond or prepare not alone, but together and within an international network of academic institutions and non-profit technical institutions, like under the leadership of WHO. We strongly believe on equal knowledge distribution, and this is why we put together different expertise from different areas around the world that give every person the possibility to attain the highest possible level of health. And we do that, of course, through this, we can say, innovative approach that is at the base of different innovative products or processes.
Thank you, Michele, for sharing all these insights about TECHNE. I think also it's an interesting point to see how important is the collaboration and in interaction between the multiple actors that are on the stage of healthcare, and also in order to be able to tackle the issue. I know we are running, the time is running fast, but Steve, a question for you. So as project director of the Country Health Information System and Data Use Program at JSI, for sure, I believe that one of the challenges that we have mentioned, like collecting organized clinical data, is very close to your work and experience. And would you like to share with us some elements of innovation regarding this topic, or some other challenges that are close to you?
Sure, thank you. Yes, I would be very happy to, and I've shared a link here that hopefully can be shared with the audience to share a little bit more about CHISU. So let me tell you a little bit about the work on the project and how it relates to this important question. So CHISU, as I mentioned, stands for Country Health Information Systems and Data Use. This is a 5-year cooperative agreement funded by USAID. And this is USAID's flagship data and health information systems project. So we are working in more than 20 countries around the world, from a huge variety of contexts, from small island nations to places as diverse as Serbia and Indonesia and Namibia, really a whole range of country health systems that we get to interact with. And the vision of the project is country health systems where stakeholders at every level can access timely, high quality data from multiple interoperable sources for decision making and policy planning and service delivery. And to do this, we have a consortium. JSI is lead where I work. We also have very important partners such as RTI, Vital Strategies, Pendulum, GemNet Health, and Gembi Health Systems, who are working to provide technical expertise as well as country context and experience in all of these places that we're working. And so what we're doing is really taking kind of an ecosystem approach to support digital transformation. We find that in a lot of contexts, there's been a big focus on digitization. So on taking a process and turning it into something digital, which is good. So we have lots of systems and we're moving somewhat away from paper. We are then the countries are moving to digitalization. So maybe there's some process improvements as they build out these digital systems. But increasingly, to really help all of these innovations and these systems stick, what we need to move to digital transformation. And so there we need to address the people and the processes and the policies and legislation that can really support everything that's going on. So in CHISU, we work across a number of different strategic objectives. The first is governance, and this is one of the most critical ones, is ensuring that the government is in the driver's seat among the many partners and many initiatives, providing clear strategic direction and policy to support these innovations, and then getting into things as mundane as technical working groups and ensuring that they're meeting regularly and are continuing to help execute the work. The second area that we work in is around systems and interoperability. So this is where we need to introducing new systems, but many places the systems, the lack of systems is not the issue, but it's helping to enhance those, it's helping to further scale those, and in particularly scale them down closer to the point of where the service delivery is. So at the health facility, at the community level, and then a focus on interoperability. So making sure that these systems can actually exchange data with each other. The third then is everything data for us. So this gets into data use, data quality, data visualization, data analytics, artificial intelligence, and machine learning. So again, to build a system is one thing, but we need to ensure, great, you have digital data at your fingertips, but if it's not being used effectively, then we're really not going to achieve that return on investment that we're hoping to see, and the reason that we're doing this work. And the fourth strategic objective that we work in underpins all three of these, which is really working with local organizations outside of the government. Everything that we are doing, we're working very closely to support government plans and to support the direction that they've chosen. But this is also then working with academia, civil society, private sector to ensure that there are strong and robust set of actors who can play a role in the work of CHISU, as well as strengthening the health information system after CHISU is finished. So those are the areas that we work in. We also have cross-cutting focus areas around gender, the use of global goods, and privacy and security. And so getting into, I think the one point I wanted to make was the need to look at this as an ecosystem, and particularly to be able to support the digitization and the effective use of innovation. Specifically around the data side, it is really critical to ensure that it's easy to design a system to collect data and to say, great, just add more fields to this. Let's ask the health workers to fill out this form and that form and this form. And yet there's no health system in the world that I can think of where there are enough health workers, where they don't already have enough things to do. And so we're just continuing to add on to this load. So we need to be very clear about, why are we collecting this data? Who is using the data? Are we using the data? And are we giving feedback to the health workers in a timely fashion? And are we using this data in a timely fashion? We are not so removed in many places from where the goal was to produce an annual statistical yearbook. And now we have real-time data at our fingertips that we can use for decision making. So as the health system and the decision making abilities, have we adapted this to be able to to be able to take advantage of this. So just a few points I wanted to add on, going back to some fundamentals of ensuring that we're designing with the user, not just a user at the national level, but actually the people who are going to be producing the work, the health workers, the community health workers, the health facilities managers, ensuring that it's clear how this data will benefit them and how they can utilize this data, and certainly including feedback mechanisms at all levels, including for those of the community. Again, we need to remember these foundational investments like in governance and interoperability. And we also need to look not just in health, but in bringing in other sets of data outside of health. When we look at things like with the One Health and malaria, bringing in climate data, there's a need not only to work within the health system for coordination, but actually being able to tap into the private sector and other sectors of the government to take a whole of government approach to achieve these difficult challenges that we're trying to take on. Thank you.
Thank you, Steve, as well for your very interesting contribution. I think maybe Nick, would you like to comment on some of the elements? Thank you.
Paolo, thank you so much. And what can I just say? What a fascinating roundtable. I feel like the work that y'all are doing is so innovative and so exciting. So listen, I just have one question for the panelists, but here's the catch. I want you to be able to answer this question in a single sentence. Always challenging for development practitioners. But here's my question. What is the biggest challenge that you are facing in your work right now in one sentence? The biggest challenge that you are facing right now in your work towards achieving healthcare and innovation in a single sentence. Who's ready? All right, Steve, one sentence.
One word, paper. Actually, I'll take the second sentence though. But so much investment in digital systems, and yet these are being implemented alongside paper systems that some health systems are not quite ready to move on from. So we're, again, just adding on to that burden. So paper is an issue. Thank you.
I love it. Okay, that's fantastic. Paper. Who's next?
Well,
Michele, you look ready.
Yes. So I think like the main challenge for us is to actually match services to needs on a timely matter and on a effective way. I think that is the main challenges, I think, for all of us, but of course for Techne.
So matching services to needs, that's powerful. Okay. Madison or Denise, are you ready? Madison's ready.
So with so many challenges, how can we focus on scalable solutions to a few that will have a larger impact, rather than not going deep enough to meet the long-term challenges that we're seeing in the field?
So I'm hearing scale, this
focused scaling,
tension between breadth and depth, and where to place those investments. I like that. Okay.
For us,
and now Denise.
Thank you. For us is a sustainability of technical equipment, especially where there is a problems of electrical connection. For us is the biggest problem, sustainability.
Sustainability of technical equipment and electricity. Okay, that's fantastic. All right, Paolo, the final word here. What do you think? Anything else to sum us up before we move on to the next section?
No, I think they've been shared a lot of very interesting points, and it was good to do also this nice wrap up of a quick overview from everybody. So I would like just to thank you, thank our panelists for sharing their ideas, and unless they have some maybe final thoughts that they want to share with us, I think we can move to the next step.
All right, and a big thank you to Paula as well for moderating us here in this roundtable. Thank you to all the panelists. We love your work, and I would encourage folks who are listening and watching to follow up on LinkedIn or other over email with each of the panelists to learn more about the work that they're doing and potentially connect around specific projects. Thanks, everyone.
Great, thank you.
Great, thank you.
Thank you.
Okay, so now we are going to move into the first round of projects. And I'm going to introduce these one by one. A reminder that you can go to the expo section of the platform and actually go a bit deeper and explore on your own at your own pace later on if you want to come back to this platform. But for now, we're going to have each of our sort of project leads do a quick presentation here. And the first one is on innovation for inclusion, CBM Italia. And this is Medere. And the presentation here will focus on the Eye for Eye project, which aims to improve the life of people with disabilities by enhancing the quality of inclusion rehabilitation services. So, yes. Welcome, friends. Over to you.
Thank you, Nick. Hello, everyone. My name is Tamara Littame, and I work for CBM Italy. Today, I will not talk about the Innovation for Inclusion project alone, but I will be with Daniele.
Yeah, good afternoon to everybody. I am Daniele, and I am the co-founder and Chief Technological Officer of the startup Medere.
So today we will talk about Innovation for Inclusion project, which aims at improving the quality of inclusive rehabilitation, physical rehabilitation services at Corso Hospital in Uganda by supporting the development of a 3D printing laboratory at Corso Hospital. So CBM Italy is a humanitarian organization working since 1908 for the prevention and treatment of blindness and avoidable disabilities in Africa, America, and Asia. CBM reaches about 5 million beneficiaries per year. In 2001, CBM also registers in Italy to implement projects contributing to address poverty as one of the leading causes and consequences of disability. CBM Italy alone yearly reaches up to 1.3 million people. So, Daniele, tell us more about Medere.
Yeah, thank you, Tamara. Medere is a startup that provides solutions in the healthcare sector. Our mission is to use the innovative technology and the digital technology, such as the 3D printing that we use in the project, to improve the experience of the patient, but also the quality of life of the patient, offering services and tools for the health.
Why do we work in Uganda? And together with Medere, we have been implementing the project together with Corso, because CBM has been working together with Corso since 2009. Corso is a center of excellence specialized in physical rehabilitation programs for people with disabilities, including children. Since 2016, at Corso, there is a 3D printing laboratory that uses 3D technology to produce ortheses and prostheses. Why do we work in Uganda? According to the Uganda Bureau of Statistics, 12.5%, so one people every 8, one people out of 8, above 2 years of age has a disability. Among them, 1.4 million people have multiple disabilities. So most of these disabilities actually can be treated, but poverty usually is a cause that hinders their access to services. So which are the causes of disabilities now, the consequences of disabilities? Number one is discrimination, both for adults and children, and their neglection within communities, but also impossibility for children, for example, to access education, and the impossibility for adults to access employment. So as you can see from the presentation, physical disabilities are the most common, almost 42%, and actually 90% of them are caused by traumas that are leading to more than 600 amputations per year. So CBM and Vedere have been working to tackle actually three main challenges. The first one is that there are some technologies in the country that are left behind and not used just because there are no possibility to do maintenance or there is a poor availability of locally produced spare parts. Number two, there was the need to diversify the services for patients, services in terms of assistive devices provided to the patients, but without affecting quality, and to provide assistive devices that are customized and affordable for the patients. The third challenge is the high cost for the families with a member with a disability within the family, costs in terms of time spent in the health facility and also transport to reach the health facilities. Daniele, I leave it to you now.
Yeah, thank you, Tamara. So we try to answer to the challenge with a solution described by three key aspects. So the first one is we want to optimize and improve the 3D printing lab that is at Corsu Hospital in terms of maintenance of the 3D printing lab, but also of the quality with respect to the object and the therapeutical orthosis that the Corsu can produce inside the lab. Moreover, we want to allow this optimization and improvement of the 3D printing lab brought some capacity, technical capacity to the staff, but also to the hospital. And moreover, we want to promote the 3D printing at the institutional and local level in order to spread the knowledge about the innovative technology and about the digital technology to the patient, but also to the healthcare system of Uganda. So now we want to describe the solution with respect to the innovative elements that we can found inside the solution. So for sure, the digital technology and the innovative technology can give physical rehabilitation solution quickly and with less cost for the health system and the family. And for sure, we can produce an insoles or an orthosis with a less waste material with respect to the traditional method. For sure, with the right knowledge that we brought to the Corsu Hospital, it's possible to maintain and the 3D printer, but it's also possible to produce directly at the hospital spare parts for other medical devices. So here in the slide, you can see a case study. So for example, you can see that there is a pediatric patient with a problem of pronated foot and partial cerebral palsy. Thanks to the digital technology and thanks also to the knowledge that we brought to the Corsu, the patient was treated with an orthopedic flexible insoles. It's important to highlight flexible because we brought also the knowledge to print and to produce new kind of orthosis with new materials to the hospital. So the orthopedic insoles restore the proper foot posture and support for the patient, and this results in an improved gait and a reduced pain for the pediatric patients. So if we want to summarize some of the results that we obtain with the project, we for sure can highlight the improvement with respect to the quality of the customized rehabilitation device that now is possible to produce directly at Corsu, and this was brought through a 3D technical improvement of capacity and of knowledge. So capacity means new materials. Now it's possible to print with flexible and rigid materials, new software that is free software, so it's possible to use also after the project, and also new hardware like new 3D printer. And we brought also some knowledge to the staff, because we make different training in a remote way, but also directly at Corsu. And for sure, all this knowledge, all this new technical capacity increase the cost effectiveness of the customized rehabilitation devices, reducing the time, the cost, and the waste material. And last but not least, the quality of life of the patient is improved. Now, for the last information about the scalability and the replicability of the solution, I give again the word to the Tamara.
Yes, thank you, Daniela. So you are maybe going to ask yourself which will be next step for innovation for inclusion. Actually, we are thinking about scalability and replicability. Our aim is to promote 3D printed products in the country, but also in other health facilities, to improve in advocacy, both at a local level and international level, to enhance the community awareness within the area where we work, and also to increase the healthcare network. How can we do all these things? Number one, increasing the number of beneficiaries that benefit of 3D printed solutions, increasing the sustainability and ownership of the hospital and the staff working in the 3D printing lab, increasing the knowledge about 3D printing among the local institutions, and lastly, reaching hospitals and patients in other regions and areas of Uganda. So thank you, everyone. Let's keep in touch. You can visit our websites to look for more information and watch some videos about beneficiaries who benefited of 3D printing assistive devices and other solutions. Thank you, Nick.
Thank you.
Thank you both so much, Daniela and Tamara. And a reminder to folks that are watching, we're going to have an opportunity to ask some questions of our incredible project presentations just after the next two. So don't go anywhere and think about some questions. I was taking notes and I have a bunch of questions for Daniela and Tamara. Okay, our next project, which I'm very excited to introduce, is a new maternity in Kassak, North Senegal. This is Rainbow for Africa, Chiwara, and this project aims to improve the hygienic and sanitary conditions of the maternity hospital in the Senegalese village of Kassak North, with a specific focus on protecting the health and well-being of pregnant women and children between the ages of 0 and 14. All right, are we ready for them to come on and present?
Hello, thank you, Nick.
Hi, welcome, friends. Over to you.
Thank you. So, good morning, good afternoon, good evening, everyone, and thank you for being here. My name is Francesca Pisano. I'm program coordinator for the Danish Refugee Council Italy, and together with me today, we have Mattia Bertolini from the Chiwara project. So, I'd like to start by telling you who we are. We are part of a consortium that sees the presence of the Danish Refugee Council Italy, which is a country office of the bigger international NGO, the Danish Refugee Council, which operates in more than 40 countries in the world in support of migrants, refugees, displaced people, and people affected by conflicts. And together with us in the consortium, we saw the presence of Rainbow for Africa and Rainbow for Africa Senegal, which are associations of healthcare workers, mainly doctors and nurses with different specialties, that have dedicated their last 20 years of life to the development of some African countries, and they also perform some work in Italy as well. And within this partnership, we had a great opportunity to get in touch with the Chiwara project, which I will leave the floor to Mattia to explain a bit about.
Thank you, Francesca, and hi all. I'm Mattia, co-founder and program coordinator of Chiwara. Chiwara is a startup studio based in Italy, but we have activity in Sahelian countries from Mali to recent projects in Senegal and Ethiopia. And our focus is to develop a technical solution for construction projects that are based on biosource materials and vernacular heritage, cultural heritage, in order to spread green, sustainable buildings and local know-how. I leave the word to Francesca to speak about the project.
So the location of the project has been identified to be the village of Kassak North, where our colleagues from Rainbow for Africa and Rainbow for Africa Senegal have performed some healthcare in the last 20 years, whereas there are also a DRC office in the whole country in Senegal. And therefore, these three partner organizations had the opportunity to perform a needs assessment, and from which we have explored the fact that in the region of where Kassak North is located, which is called Saint Louis, there was basically no facility that was good enough to perform mainly support care for women and pregnant women and children below the age of 3. The estimated population of the village itself is more than 3,000 people, but the region itself hosts more than 30,000 people. Therefore, we saw a great potential in improving the maternity that was in very bad conditions because of the scope of the maternity itself, the geographic location of it, and also the population that could benefit from the better condition of the maternity. Given the fact that the nearest hospital is more than 2 hours away driving. What was the challenge, which was quite ambitious, I would say, quite ambitious. So given the population living in the village and in the region, where the majority is constituted by women, and women in the childbearing age constitute the more than 20% of the whole population, and the children below the age of 5 years old represent almost 20% of the population, we thought that an intervention to the maternity was very much needed. The previous conditions of the maternity, as you can see from this image, which is quite clear, were quite bad. Not only in terms of efficiency and energy efficiency, but also in terms of overall conditions. And therefore, we believe that an intervention, a structural intervention, was necessary. And to do so, we got in touch with the colleagues from Chiwara, because we believed that the impact of a structure that was not only a better structure in terms of the way that the building was built, but also in terms of the efficiency of the building and in terms of the development of capacity building trainings for the population to keep the building as it was and as it could continue in providing the assistance to the whole population was essential, with the greatest aim of decreasing the neonatal mortality rate and also the overall well-being and health care of women and children in the village and in the whole region. To talk about the solution, which has very much technical aspects, I will leave the floor to Mattia, who is the expert in the field.
Thank you, Francesca. As Chiwara, we don't focus on, let's say, a panacea solution for all locations, but we go to the location and we understand the challenges of the place and the opportunities given by the surrounding environment. In Kassak, we identified different types of materials as well as analyzed the structural situation, which was in such bad conditions that was impossible to, let's say, refurbish or readapt structurally with an acceptable cost. So we decided to demolish the current maternity hospital and delocate all the activities temporarily in another location. And the materials that we identified that were pretty much available in the place were clay soil and infesting algae from a nearby river. Unfortunately, for some social stigma, we couldn't implement a fully earthen structure in the place, which could even improve the result we achieved. But we used clay as a filling in order to increase the thermal properties of the envelope of the maternity, and algae, infesting algae from the nearby river, which are disrupting agriculture in the village. We dried them, we mixed them with soil, and we use them as insulating materials from the roof, which has to bear really high temperatures. And this affects all this energy performance of the building. This improved performance affect the overall quality and salubrity and hygiene of the interior space. So also the durability of the building itself. This whole process made by biosource materials and natural elements, but with a local manufacturer, was made through trainings and the development of local know-how that will help also improve the durability of the construction itself, will help increase the maintenance of all the elements, mainly the structural element, the insulation materials, and also to replace them whenever they will have any kind of issue. So in total, we trained directly 18 construction workers, both from the region and from the same village, and 12 maternity health workers were trained on the management of the new facility and the new equipment that was brought to Cassac. Indirectly, obviously, this kind of intervention for us is affecting the whole people in the Cassac basin. The scalability of this project is ensured by the fact that we used almost completely local materials, and also we could even push forward to increase the amount of local materials used by in the construction of the maternity. Low cost have been ensured by a local production process, but it can even further achieved by the implementation of a full training program, because this kind of technique, even though they are simple and based on local resources, they need a full training program so that construction workers are not intended to be special workers, so not rare, but they will be diffused, and the technique could be replicated easily in other locations. I guess this is about all. We left all our contacts, and feel free to contact either Francesca, me, or Paolo, president of Rainbow for Africa, who couldn't join us today.
Thank you.
Francesca and Mattea, thank you so much for sharing this presentation with us. And a reminder to folks who are watching, you will have a chance to ask all of our panelists some questions after we hear from our one last project in this section. So thank you to both. Don't go far, and we'll come back in a sec. Our final presentation in this section, we are going to hear from Kokono Cribs, Going Safe and Green. This is MREF Health Africa, JengaLab, Sride. Kokono Cribs, Going Safe and Green, contributes to reducing infant mortality by supporting maternal health and child health and safety in Uganda with the on-site production and distribution of a multi-purpose, low-impact crib. And we've got here Lucia and Daniela to share with us. So thank you both. Over to you.
Thank you so much.
Thank you, Nick.
So, Daniela, you can start.
Yes, well, you will share. Okay, so good afternoon, everyone. My name is Daniela Rana, and I'm Program Development Specialist for MREF Health Africa. And I'm here today with Lucia, who's CEO and co-founder of JengaLab, the innovator with which we have been partnering for the initiative, Kokono Cribs, Going Safe and Green. AMREF Health Africa is the biggest African organization dealing with health all over the continent, but specifically in Eastern Africa, which is also where we placed our innovative solution. Well, JengaLab, our innovative partner, is B Corp and dealing with social innovation and solutions about inclusive business. We are very pleased and proud to be here today to present our partnership and also the solution we've been developing over the last month, years, we would say. We've been targeting Uganda because of its specific features, especially social demographic features, upon which we have been built and developed our initiative and solution. Because the country sees almost 3/4 of its population living in rural areas. It is a country with a very young population, and its child mortality rate under 5 is still very high, quite high, despite the very huge progresses that the country has been making over the last decade. And some of the top causes of death for children are still highly preventable diseases, such as malaria, for example. The challenge we adopted is related to the prevention in local communities and vulnerable groups, and is referring specifically to the reduction of mortality and morbidity for children between 0 and 12 months. Children who are particularly exposed to risks related to lack of protection, especially when they need to follow their mothers, and their mothers are going to work and they are left unattended on the ground or on the floor. They are more exposed to risks of being stepped on, for example, or risks of being bitten by animals, for example, rodents, reptiles, mosquitoes, insects. But they're also more prone to the risk of suffocation due to some co-sleeping practices, especially in rural areas where houses could be smaller and an entire household could sleep in the same bed or under the same mosquito net. The methodology we adopted is a community-led process. That solution was co-designed together with the communities, and Lucia will talk more in depth about that. And also the promotion of Coconos has been made through AMREF support to the Village Health Team Network and to existing women groups, so the so-called merry-go-round groups in Kampala. So groups were engaged in routine savings and or credit management, so also through loans. We have now an agreement in place with Opportunity Bank for that, to access loans or savings and buy and then resell Coconos, so to become also income generating activity. The VHTs, the Village Health teams, in parallel took that opportunity to sensitize the mothers and the communities on infant care and also on the appropriate way of using the crib. Up to you, Lucia.
Okay, thank you. So yeah, building on what Daniela was sharing with us so far, the solution that we tried to customize and to design really from scratch was this baby crib that you see in the picture here on the slide. It's conceived in order to, as said, fight against infant mortality in order to reduce it where it's mostly spread, and of course, in order to be accessible to our beneficiaries, we conceived it to be multi-purpose, so to be used as a baby crib, as a washing basin, and as a playground. So it has these 3 functions all together. It's like a baby house for the infant. And it's conceived to protect babies from 0 to 12 months. And the process through which Cocono is being produced is the most sustainable possible in Uganda, because not only it's entirely produced there, so everything from the net to the mattress inside, everything is locally produced, but also the consumption and the production and the consumption model is the greenest possible, as we've decided to use a special organic polymer that makes cocono compostable, so biodegradable in a few years if abandoned open air or in the water. So here we are, I mean, the challenge that we wanted to address was to couple social impacts and environmental impacts together with a very simple solution. I mean, innovation is not necessarily something digital, right? It's also something which works that was not there before, so it's new. But in this case, it's quite frugal because it has to target low-income communities that cannot have a big purchasing power, you know, to afford more complex tools or devices. So the innovative elements of Cocono are the fact that it's really a brand new object. So there was nothing similar before, and we've been asked to patent it in order to protect from fake copies. And that's what we did. Of course, there are no royalties on that. It's just to protect it from, as I said, illegal copies. It's multi-purpose, 75% of it, it's fully compostable. What is not compostable is like the mosquito net, because actually we don't have anywhere in the world compostable mosquito nets or mattresses that are breathable. So these are additional things that we could keep as a challenge for the future. And then it's been designed engaging almost 200 end users during a research trip that JengaLab carried out in 2018 in order to collect information from end users in Hoima, Kampala, Gulu, and Fort Portal. So before designing it, we asked local people, how would you like the perfect baby crib to be? And so we came out with these ideas of being versatile, being simple, being big enough to protect the baby from 0 to 12 months, which are the most, which are the months in which the baby is more fragile and needs more protection. And there is absolutely no packaging, as you can see, so it's assemblable by end users, and there are no wrappings that could create waste. The results so far have been very encouraging. This is a picture of the results referring to the pilot project, so where we had the opportunity to produce 1,500 cribs that were sold in 12 months. We won 3 grants at national level and international level. We had a crowdfunding experience, which we started as a test, and it went very, very well. We doubled the goal in just 2 weeks, and we had the chance to engage prominent actors as, like Daniela said, Opportunity Bank, as a financial partners for mothers that are willing to purchase the crib to resell them, so that Cocono could also become a viable option for generating new income for women. Supply chain, fully Ugandan, as I said already, and part of the supply chain, the one that engages the seamstresses that are producing the customized mosquito nets, are targeting fragile women, so disadvantaged women. So it's also very sensitive in this regards on the type of actors engaged in the supply chain. Hospitals are currently using Cocono for assisting their baby patients, and for also using Cocono to train mothers and to protect babies from, for instance, SIDS, sudden infant death syndrome. This is a project that is engaging Chiwoko Hospital, for instance. We had the chance to distribute the cribs, engaging the Italian Development Agency offices in Nairobi, UNFPA, and other NGOs in Malawi as well. And overall, the direct and indirect beneficiaries are like more or less 4,000 and something. So the scalability, it's quite huge, not just because infant mortality rates are massively spread all over Africa, but also because the product, as you can see, is quite simple. So it can be used for different needs. We would like in Uganda to scale up in different areas, different cities, but also engage other beneficiaries, like, for instance, refugees. Uganda has one of the highest ratio between refugees and local population. So why not looking into that area and increase the women-led distribution that is currently helping us in the last mile distribution strategy. Beyond Uganda, of course, we would aim at distributing the crib in other African countries, not just Uganda. Uganda can be the main hub, but there are many neighborhood countries that are in need. Sell the cribs also to different players. So we think that there is a very clear linkage between skin-to-skin policies, for instance, that are promoted by UN, particularly UNICEF in Uganda, but beyond as well. So why not creating a common strategy with this type of institutional actors, and then sell the cribs through the engagement of other development agencies in other African countries. So it's a very, simple but effective tool, we believe, that could be used to strengthen other projects related to childcare, women empowerment, even sustainable production and consumption, and of course, targeting SDG 3, which is the main one. Milestone so far, okay, the production quality checks, as I told you before, everything is done in Uganda. The shell is printed out at industrial level in order to be easily diffusible in where needed. Community outreach experiments have been carried out already in different areas. This is a picture in Kawempe, an area in the suburbs of Kampala. Then here, well, it's me training distributors and other retailers on how to assemble the crib. This is the beginning, the launch of the opening, of our shop. We have a flagship store in Kampala. So these were the first 10 cribs delivered with the boda boda to the shop. So this was a very brief snapshot of our activity. We just wanted to, interact with you on that. The pictures here show also another effort that we are doing to distribute the cribs through this van. It's a van really that is going around in different villages and presenting and selling the crib. So everything, I think it's up to all of us for strengthening the possibility to protect babies with this very simple but very, very effective product that's Cocono. Thank you.
Fantastic. Lucia, Daniela, thank you so much for sharing your innovation with us. I'm now going to invite, we have about a few minutes here, I'm going to invite all of our project presenters onto the stage and encourage folks who are watching us live to drop a question that you might have from any of the presentations that we heard from in the platform, and we will do our best to accommodate it. But as we're waiting for some of those to come in, I have a question for the first group. That's Danielle and Tamara. I am a professor at Columbia, Georgetown, GW, and I have taught courses that include 3D printing. And I will say this, every time we go to the campus 3D printer, it is broken. There's some kind of problem with it. So I'm curious, maybe Danielle, you can speak to this. What kinds of things do you do to maintain this technology in, particularly in remote locations? I'm imagining Uganda is a hard place to operate these machines. What are some of those challenges you face, and how have you overcome them?
Yeah, thank you, Nick, for the question. So we try to give some knowledge to the staff in order to maintain the 3D printer. And the problem, the most common problem that staff face up is the cleaning of the 3D printer, because in the 3D printing lab of the course there is a lot of dust, and so for this reason the fan of the 3D printer are full of dust, and the cleaning of the fan is an important part with respect to the quality of the 3D printed object. And for sure, also the setting up of the 3D printer is very important. So we give to the staff some manual in order to have a guide when face some problem, and can see inside the manual to try to repair the 3D printer. So if the problem is the cleaning, maybe the staff can clean the extruder, can clean from dust the fan, and can have some better quality with respect to 3D printer, but also with respect to other problem that can be with respect to the parameters of the 3D printer. We bring knowledge and give manual to the staff. So we try to solve this problem with the knowledge that we have at Medere, and we try to pass this knowledge to the staff.
Thank you so much, Danielle. I'm going to invite Paola to ask our next question to the last group.
Excellent. Thank you, Nick. Thank you, guys, for your presentation. So I have a question, yes, from for AMREF and the lab. So it has been mentioned that the Cocono project is aiming as well at empowering women through your innovation. So how is AMREF ensuring that this element is covered and tackled properly?
Yes, thank you so much, Lucia. I'll go with it. Then you can add if you wish. We were actually trying to ensure that in many ways, especially by trying to build a kind of, as mentioned before, income generating environment for women, purposely for women. So women groups already existing. For example, merry-go-round groups that were accessing or trying to access to microcredit were identified and empowered on that to become retailers, basically, of coconuts. In order to create, so 20 of them were targeted, 20 groups, in order to become retailers and create an actual network of women retailers and sellers of coconuts, while constructing a network of income generating activities. They were also empowered in their capacity of taking care of the babies because of the parallel work of VHT, sensitizing also on proper infant care. Just to add on that, we also made sure that many other women were employed in additional activities or side activities on this. For example, involving them into the creation and production of mosquito nets, as we were saying before. And on the top of it, we are also trying to reduce the burden for the mothers who need to work. So for the mothers to carry the baby the whole day on their backs. So Cocono is also a good tool to basically free the mother from the burden, I mean the physical burden, to carry the baby the whole day on their backs when working, and so they could leave him or her in a safe place. So that's basically the system that we wanted to build.
Okay, thank you, Daniela. I think this answers as well the question from the chat from Rebecca. So thank you so much for this.
Thanks, friends. Francesca and Mattea, I found the example you shared, the maternity hospital in the Senegalese village of Kassak, to be fascinating. I'm wondering if you can talk a little bit more about how you balance the cultural considerations in the Senegalese community, expectations they might have for building design, hospital healthcare, with the green biosourced building standards that you all brought. You alluded to this, but I'm wondering if you can go a bit deeper and talk also about some of the challenges you might have faced in trying to balance those.
I guess I can take this, Francesca. So yes, it is not easy. It's I would say 80% part of our job to find this balance. It's also because sometimes we get a bit too much focused on what is environmental friendly and what are also the cultural needs also, because they are needs locally. In this very project, our biggest issue was that we went there, we analyzed the place, we proposed a design which was based on vernacular techniques that were modernized. And let's say the community was really happy about this proposal we made. Just we did a mistake that we didn't knew. Now we learned also from this project that we didn't go through the upper levels of society. So let's say on the governmental level. So we presented this project together with the community to the mayor of the village. And at our last meeting, he just didn't accept our proposal because he was not convinced on the durability of this technique we were proposing, even though we always have local engineers, local technicians, so it was not our direct voice from the outside, but just was not convinced. And we just learned that we should have taken any other steps to do a bit more, discuss a bit more, share early ideas, talk with other stakeholders on the government level that would have been supportive to us and might have led to a fully environmental construction in that case. So I would say we can take the mistake could have been that we went directly to the people and while even, let's say, inviting the authorities, but maybe we should have worked in parallel. In other situation was the opposite. So we don't have a rule because sometimes we got the approval from the government and the community didn't just want to work with this. That's why we found other solutions and we just merged a bit. We tried to find a flexibility in between what was our desire, our objective, and what we could do.
Thanks so much for that answer, Mattia. So I'd like to close by thanking all of you, Lucia, Daniela, Francesca, Mattia, Tamara, Danielle. Really so impressed with all of the projects that you are working on and innovating on, and encourage folks who are watching to go explore them in further detail in the expo section of the platform, and and connect with these great projects if they inspire you. So with that, we are going to pause here for a 10-minute break, but don't go far because we still have a fantastic keynote coming up. In fact, 2 more keynotes and another round of projects. So I hope you can stick with us, but we will be back in 10 minutes with our first keynote address, which we're very excited about. So that's all from us. And again, a big thank you to our panelists who joined us today and shared their projects. Okay, welcome back. Thanks everybody for your patience. We are excited to get started again with our first keynote, John Paul Omolo, the Senior Policy and Advocacy Officer at PATH. John Paul, you are a public health professional and a health policy analyst with a vast experience in health system strengthening and health policy advocacy. You have extensive experience also in health policy formation, monitoring and evaluation, health system strengthening, and program management. And you are currently the Senior Policy and Advocacy Officer at PATH, leading PATH's Africa advocacy work on pharmaceutical manufacturing, regulation of medical products, and health research and development. So I will stop there and turn it over to you for your remarks.
Thank you so much, Nick, and it's really a pleasure being part of this really exciting summit. Just confirm that you can hear me loud and clear, Nick. Nick, can you?
Yes, we can hear you wonderfully.
Nick, are you able to hear me, please? Confirming.
Yes, we can hear you, and you sound great.
Great, thank you so much. I really want to really thank the organizers of the Coopen Summit and for inviting me and PATH generally to be part of this great conversation. I work for PATH, which is an NGO that has a global footprint, and we work to accelerate health equity by bringing together different institutions, businesses, social enterprises, investors to really solve the world's most pressing health challenges. And that's why this is a really important topic for us moving forward. I would also want to really appreciate the presentations that were made earlier. They were really inspiring. And when we think about innovations and health, this is the entire thing and the context under which I'll be speaking to. I want to mention that the greatest inequalities that we will be having, or we are currently having in the 21st or 22nd century, will be based on digital connectivity and innovations. Countries that are either connected or not connected, or countries that are either advanced in innovations or against those that are not. And it is important that we know that that will be one of the greatest inequalities that we will be facing in the globe. So how then do we define innovation within the healthcare space? It denotes the better, from where we see it, it denotes new and better or more effective ways of addressing healthcare challenges, and includes things like the policies, the systems, the technologies, the ideas, the services, the product that really makes the healthcare and addresses the healthcare challenges. The golden standard for innovation in the healthcare is the intention to improve that quality of life through new treatments and new technologies and processes. And as you're aware, if the greatest inequality will be among those that are advanced in innovation and not, we do know that low and middle income countries, especially continent like Africa, will be faced if the continent does not adopt the right innovations in the right time, then we will be creating a lot of imbalance, and that might not be very good for this continent. So health innovations generally provide an opportunity to really strengthen the health systems from those very minor improvements to those radical changes that can help countries address some of the traditional barriers to meeting the health needs of the population. And therefore, innovations really fosters the development of learning the health systems, where those internal data and experiences are systematically integrated with external evidence, and that knowledge is put into practice, resulting into those very high quality, safe, efficient healthcare delivery of organizations. So why then should we care about health innovations? And it is important to look at that question by asking ourselves, where is the future going? How does the future look like? The future has about 5 key things around the healthcare system, where the innovations will come to to really address. One is the issue of precision medicine, where treatment will be tailored to very specific person-centered or person-centered kind of treatment, where those treatments take into account the genetic and biological makeup. We'll also be looking at the second thing is where we are moving away from the clinic-based care delivery to where we are providing healthcare at the comfort of the patients at home. The future also looks at remote procedures where somebody, doctor, physician, would be sitting somewhere in the global north and conducting a procedure in the global south, where those groundbreaking medical procedures are performed also through robotic and surgery. And of course, we know that there would be that taking place, and right now we've started seeing a lot of that taking place in our institutions. Also thinking about the automating the repetitive tasks, where simple procedures will be boxed and would become widely available over the counter. And lastly is, our smart wearables, where smart vests for measuring blood pressure, electrocardiogram, or medicines in patches. And I think all of us are currently aware of the new vaccines that are going to be patched and are currently on late-stage clinical trials. And we see that governments are currently adopting new innovations health. Specifically, I wanted to call out the data use partnerships that is in Tanzania, which currently is really trying to strengthen the digital health and data policy, trying to advance digital health capacities through training, co-creating and connecting digital health systems, and of course, looking at the coordinating digital health actors locally and globally. The issue of interoperability of the different systems and structures that are in place around digital health and innovations. I also wanted to speak to largely around why governments must then prioritize innovations in the healthcare system. I've alluded to some of them, but it is important that we look at why innovation at this point, and when we are moving from this current phase, 21st to 22nd century. The healthcare system is largely and continuously faces new emerging challenges. Specifically, we now have pandemics and epidemics. We have emerging and re-emerging diseases. We are seeing more communicable diseases. We are seeing NCDs coming in. These new challenges demand that we take action in regards to innovations that would then enable us detect these diseases faster with precision, and that will also guarantee safety. Also, one of the main reasons as to why we must prioritize is that governments have been moving towards universal health coverage. And if we know the cube of universal health coverage, it's looking at the services, looking at money, and looking at population that is being covered. Of course, and with this kind of thinking and approach to healthcare, we need the current healthcare challenges within USC cannot be addressed if we do not embrace innovations, which of course would assure countries of physical access, quality, and safety of all the services that are being provided. Of course, the healthcare system is also becoming more personalized. I talked about precision medicine, where we are going to start receiving very personalized, individualized, person-centered care. And it is important that governments adopt this early, because then that is the way even prescriptions and medication will be provided. The issue of value-based care, we have always had that there's leakages that are happening within the healthcare system. And it is only through innovation that we will not now look at the input-based, but we look at the outcome-based kind of care, where it is not about the medicine that you are receiving, but in terms of how fast you get better and how safe the medication is on you. So looking at that value-based care is a really important thing, and that is where we are heading to. The issue of acute health especially in LMIC, is a key important impediment within the healthcare system. And it is important that we realize the place and the place for innovation. As we are thinking about the shortages of especially specialists within the healthcare system, innovation can help us and help those marginalized population to really access the care that they would otherwise not have access because of remote and telemedicine and those kind of things. So there are key things that we need to look at, even as governments are thinking about innovations within the lower middle income and even globally. We need to think about those consumer focused, where we look at what does the consumer want and how can the consumer buy or procure this service and access this service. So that's one thinking. The other thing is looking at the technology and looking at the new developments and how new treatments. Right now we have the mRNA vaccines and the DNA vaccines. Before COVID, we would not have introduced these new platforms of vaccination as fast as they did during COVID-19. And of course, the third thing is the issue looking at the new business models, and particularly those that involve integration and interoperability among the different institutions, the private sector, the public sector, and how all this now feeds into the global health observatories. But even thinking about all this and wanting to see all these nice things happening in the health sector because of innovations, we must really address the triple helix of all this in terms of looking at what would be some of the enablers, current enablers, or even barriers to adopting new innovations in the health sector. We know that the industry players are really important. Public, private, and even the population, because until and unless the population adopts these things, the new innovations, that you cannot deploy it. We need to look at the funding mechanisms. A number of times governments might operate within a very tight fiscal space, and it is important to look at who is going to fund these innovations. The issues of the policy, public policies or policies around innovations. How are people's data guarded? How are we looking at the policy environment in totality so that it can be an enabler to innovations in the health sector? And lastly is the issue of interoperability that I mentioned, because we have several innovations that have come into the health sector, but we need to see how best can we make sure that they're interoperable. And of course, if there are things that if we don't do, then the cost of inaction is very high. So what are some of the cost of inaction if we do not act yesterday? Is it that then we will? One is that, of course, the non-adopters or late adopters will be left behind. UHC calls out for leaving no one behind. And of course, if we leave anyone behind, it means there are those that will, no one will be safe. There's usually the slogan, no one is safe until everyone is safe. So we need to make sure that we do not leave anyone behind, and we are able to make sure that, with innovation, the identification, the diagnosis, the treatment is done as fast as possible. Of course, the issue of increased cost of care will be continued to be faced. We know that innovations help us reduce the cost of care, and it will really help us address the issue of access from a cost point of view. The issues of late detection of diseases and illnesses due to poor surveillance systems or limited use of digital health will still be seen if we do not adopt innovation. And especially when we think about the increased mobilities, the disability, the deaths, we need to embrace innovations, because it is only in that way that we are going to reduce mobilities, disability, and deaths. And of course, the last thing that I wanted to mention under this is that at household level, it will result in higher out-of-pocket expenses if we do not adopt innovation. And if we want to reduce out-of-pocket expenditure, we must then therefore adopt innovations in the health sector. The last bit that I want to mention to talk about is what then are we asking governments to do across? One is that we need governments to really adopt investments especially domestic investments by governments that would finance digital health and innovation across the entire spectrum of healthcare. We need also to be deliberate with our governments. We need a lot of deliberate actions by our governments to adopt and increasingly roll out innovations. We need to move from pilots to a lot of rollout of the healthcare system. And of course, institutionalization of policies that within the ecosystem that would really support the rollout and even introduction of new innovations. And lastly is the issue of coordination of all partners that are supporting healthcare innovation within the country, within the region, within the continent, and even globally. Thank you, and back to you.
John Paul, thank you so much. What a riveting talk. I think you've laid out so many fantastic dimensions to this conversation. The things that stuck out to me, I loved all of the different examples you highlighted, from precision medicine to remote care to automating repetitive tasks, smart wearables, and then of course interoperability, which is a topic that I'm personally very passionate about at Tech Change with our digital health work. And then I think you've laid out a really compelling case for why governments need to prioritize innovation, trying to balance what consumers want with what the technology is capable of and what it can do. And then your final points I caught were just like trying to encourage governments to really make those domestic investments across the healthcare spectrum, be really deliberate in rolling out these innovations, like some of the ones we've heard about already today, and then serving as that coordinating entity. So I think you've left us with some really powerful thoughts here, and I'm excited to invite others who were inspired by your talk to connect with you. Thank you again for your remarks, Jean Paul. Great. So we are now going to move on to our second round of projects. And we have 4 in this particular session that we're excited to share with you all. The first is called Introducing Innovative Educational Models for Health Personnel in Kenya. And this is a partnership between Comunità di San Egidio and Ilara Health. I hope I have gotten close to those pronunciations. But your project, friends, is an intervention involved in the development of a digital training platform for clinicians that offers modular training, tests, discussion forums, and access to databases on national and international guidelines. So a big welcome to Sven and Anna Maria.
Hello, everyone.
Good afternoon, everyone. My name is Anna Maria Doro. I am a member of the community of Sant'Egidio, and I work in DREAM program as technical support for project office. Let me also introduce my colleague Sven Modrow, head of special projects for Ilara Health. So, in 2002, the community of Sant'Egidio created the DREAM program to guarantee free access to treatment for people living with HIV in 10 African countries, including Kenya. The program aims to guarantee the best possible care, even for the poorest, with a strong focus on innovation and enhancement of diagnostics. And we are currently also working on treatment and prevention of non-communicable diseases. And in Kenya, we support 8 health facilities with more than 10,000 patients in care. So Sven, could you please introduce Ilara?
Yeah, we at Ilara Health, we equip primary healthcare clinics in Kenya. And so far, we have worked with over 2,000 of these clinics. And we lease out diagnostic devices to them, which can be anything from an ultrasound device to over different blood analyzers. And we equip them also with electronic medical record systems, and now have started also to educate the clinicians in these partner clinics through a medical education platform, and to really help the clinicians to be more successful. And this project together with Sant'Egidio has been the perfect fit. So both organizations in coherence together, we have the healthcare expertise, we have the local presence, and we also have that experience with working with healthcare professionals and with training. So it was the perfect match, and yeah, it was an exciting project. And in Kenya, as most of you probably know, a large share of the population lives in poverty. There are also quite some difficulties on the ground when it comes to the healthcare situation. And one major thing is really the quality of care that is provided. And of course, you can provide equipment to the clinics, but often it then comes down to also the training of the healthcare personnel, and they need to stay up to date. They need to be informed, and there is a very big need. And that's then where we came together and really said, how can we improve quality of care by really upskilling and training the healthcare workers?
So in 2021, through the participatory process of Coopen, we identified this challenge to promote training of qualified medical and healthcare personnel. In fact, in Kenya, the health sector lacks quality care due to a difficult access to education and a shortage of highly qualified clinicians. As a result, healthcare tasks are transferred to less qualified workers, and patients' diagnostic and treatment needs very often are not met. In the next slide, we will see the activities that we put in place. So the backbone of the intervention was the online learning platform set up by Ilara Health. Initially, we involved the clinic directors and invited their clinicians to register and participate in the online training available in the platform. Online courses focused on improving operational tools and knowledge on prevention, screening, and diagnosis of specific non-communicable diseases within the framework of national and international guidelines. Online discussion forums were specifically organized in order to let clinicians share problems and solutions and develop more discussion among them and with medical specialists. A practical training, specifically called postcopy internship, was also provided, and during the project we visited the healthcare facilities involved to make sure that the national guidelines and training contents were applied by the clinical staff. At the same time, we monitored the impact through patient questionnaires, through guideline dissemination assessment, as well as client exit surveys. Lastly, our experts participated to radio broadcasts on non-communicable diseases and conducted health awareness activities, which made it possible to reach and inform the most remote areas and the most fragile communities about the health services offered.
Yeah, when you look really at the platform that we have been creating, it consists one of these just online courses they can access 24/7, videos, quizzes, presentations about all kinds of different disease areas in healthcare management. But then what it really also sets it apart is this community where we said, yes, we as externals, we can provide them with information, but the most interesting thing is when the clinicians also help each other and really have this ongoing conversations of what challenges are they facing, what do the others think, and then we have our experts who can jump in. And that is really something unique that does not exist elsewhere, and we have been seeing incredibly reception of this, and this is really great innovative approach to educating and also empowering the clinicians on the ground, because a lot of the knowledge then comes from them. This work has been exceeding expectations, and we are extremely proud of what we have achieved. We have trained in this pilot program 305 clinicians. We created 16 courses on non-communicable diseases, had 6 discussion rounds, and 11 colposcopy training sessions with extreme high levels of participant satisfaction. So considering the success of this project, we want to scale this up, and we want to reach now in the next 12 to 18 months many more. And so we want to educate these 3,000 healthcare professionals, and believe that as we now have this platform, the backbone already exists, and the more and more people we add on top, it will not require too much work, because we have the platform. So it's more about getting the people on board, building some content, and to really educate masses. And we're looking for funding of 300,000 euros to really reach these 3,000 healthcare professionals, and are very open to any one of you to reach out to us, to network with us. Here's a slide from the larger team, and feel free to connect with us on LinkedIn or via email, and we are very excited to get in contact with you.
Thank you both so much, Anna Maria and Sven. So a reminder, I'm going to invite you all back on stage at the end of this session to answer some questions, but it was really wonderful to get a quick glimpse of your great work. So next up, we have a new medical learning hub for St. Mary's Hospital. This is Fondazione Piero e Lucille Corti and Tech Care for All. So a big welcome. It looks like we have Elisabetta and Benson joining us. And for those that are curious, MLH supported St. Mary's La Cour Hospital in implementing a mobile e-learning plan for routine CMEs and maternal, newborn, and child health themes. We're going to learn more about that from you both. So over to you.
Okay, thank you very much, and good afternoon to everyone. I'm Elisabetta D'Agostino, from Head of Project from Corti Foundation, and with me there is Benson, Dr. Benson Chuma, Take Care for All. We worked together and implemented together this project, which aim was to support St. Mary Hospital La Cour, which is the main and unique beneficiary of Corti Foundation, in improving and facilitating the access of its staff and students to quality health care trainings. As you can see, the partner of the project were Corti Foundation with the medical education technology platform developed from Take Care for All, and the main beneficiary was St. Mary Hospital La Cour. La Cour is an hospital based in the Gulu district, northern Uganda. It was founded in 1959 as a small health center from Comboni fathers, and grew up since the beginning of the 60s under the leadership of Lucille and Piero Corti, a couple of medical doctors which spent all their life taking care of the hospital. Under this leadership, the hospital became one of the main private not-for-profit hospitals all over East Africa and Uganda. Currently, the hospital is serving a population of around 750 people and has a bed capacity of almost 500 beds between the main hospital and its 3 health centers. Here some data about the hospital yet. As you can see, in 21-22, the hospital has treated around 208,000 people, out of which, out of them, 25% were children and 55% were women. It means that the 80% of our total patients are these children and women, the most vulnerable groups in the areas. And out of the actually the one of the main services provided by the hospital are maternal and child care, with around 9,000 deliveries per year, with 2,398 cesarean section. It means that Latour Hospital is the main health services providing cesarean section in the area. Most important for our project, the hospital has around 799 people working at Latour, including medical doctors, medical officer, technician, lab technician, nurses, and interns coming from Gulu University mostly. And beside them, there is a number of people or students coming to Latour schools for midwifery, nursery, anesthetic, and laboratory technician. The main aim of the project was to provide both the staffs and the students with the possibility to access quality training and to participate in the continuing education meeting that all the main hospital and all wards are organizing weekly, monthly, and in different kind of section and format, and to allow them to also access accredited certified training. And so the other aim of the project was to accreditate the hospital as a CPD provider. I leave my colleague, Dr. Benson from Take Care for All, to a bit explain better than me that how I could do the main challenges the hospital was facing, the solution provided by Take Care for All, and finally the results we achieved. Thank you very much. To you, Benson.
Thank you so much, Elizabeth. I confirm you can confirm you can hear me?
Yes.
Okay, great. So it has been a great pleasure working with St. Mary's, having Elizabeth as a contact person, working with the rest of the staff. The challenge that the hospital faced is that they wanted to improve access to content for their staff. And this is really the key solution that they wanted to have, is to improve e-learning. And when it comes to e-learning, there was no technology or a platform used for that, as well as the expertise. And really another problem is that without an ability to have on-demand content access, is that then there becomes inconvenience. Registration of people into courses is manual. And there also, even as we implement e-learning, and we know that it's not the key, it's not a magic bullet. So connectivity is a challenge, visibility of courses, as well as ability to improve access to international or regional content. Our platform then once we learned and understood the needs, is that then we proposed implementing a platform that has both online and offline access, and the offline is largely via a mobile app, whereby you can download content, automating registration, and really helping ensure that there was automated registration and better reporting of attendance. And lastly, improving access to CPDs. We found that this is a key factor, drawing factor for healthcare professionals. For CPDs, the continuous professional development points. And what that does is that it's needed for renewal of licenses. So with that said, our solution then, when we look at what were the innovative elements, is that how our platform worked is we provided the hospital with a microsite. This just means like a website. It's a landing page whereby all the training of the hospital, all the courses, they are hosted and customized. We also, towards the end of the project, launched a mobile app, which now is being used and introduced to the hospital, whereby content from the CME is happening every week, as well as content from the other sources is adapted and uploaded, and people can actually access it online or can download it and access it offline, say, for example, in their home. So effectively helping overcome the challenge of lack of or poor internet connectivity. In addition, we recorded and uploaded the weekly general and some departmental CMEs, effectively making them easier for access to people who may have missed that. We are in the process of automating issuance of CPD points. So we have worked with the hospital to get them accredited, as well as our platform is also now accredited, and healthcare professionals accessing content, can be they doctors or nurses, can now access the CPD points, which is a very strong factor, as I said, to increasing uptake and engagement. We did some live simulations of KeyMonk. This is an advanced course in obstetric care, and we also got some content which is a pretty brand new content from WHO, and we were able to provide it. And it comes to, it's focused on improving labor care, the kind of care that mothers get when they are in labor, and it has the most recent recommendations from WHO. Looking at a bit of our results, is which we are equally proud of, is that we were able to have 15 courses, and these courses are continuously uploaded and available online. We had about 1,000 and 1,100 plus almost 1,200 total number of people who registered and accessed content. We are very happy that we were able to digitize, run a workshop, as well as record and digitize content on the comprehensive obstetric care. Similarly, we just finalized the process, or we finalized the process of getting CPD accreditation from the Medical Council for doctors. We are in the process for finalizing with nurses, as well as for the other one that deals with lab techs and farm techs, which is called the Allied Health. And we are also particularly proud that we got the opportunity to train the ICT, the hospital ICT team, to set up courses, to run the events, to record them, even without having to have our team members physically present, and even at times with very limited remote support. We found that they are able to upload content and upload courses onto the platform. Thinking of scalability and really sustainability, is that today we have a very strong, what we feel is a very strong foundation. The hospital has a landing, what we call a microsite. It has, as well as the mobile app. We budgeted for equipment that is going to help the recording. Some of that has already been availed. And the hospital has also been trained. And in fact, they're talking of Conversation is now, Gulu being the big hospital, as was shown, working with satellite hospitals. As startup, having been part of this accelerator as well, we're very happy that we were able to forge and have conversations with other organizations, an organization called Solitaire, where we are looking at working together with Solitaire, as well as St. Mary's, and doing widening our scope to look at even pediatric oncology. Again, we're very happy that we were able to sign an MOU with UCMB. This is the umbrella body for Catholic-based, faith-based hospitals in Uganda, and we are having conversations on how to take the learnings that are done in Lachol to cascade them to all the other Catholic facilities, which offer quite a significant proportion of care in Uganda. When we think of the next phase, is we are looking at, if we just look at St. Mary's Achor, we are looking for partnerships. We are looking for partners to look at, to cover cost for extending this beyond what we can call pilot, as well as looking at the other 3 satellite facilities, and with rough estimate of the amount, $30K USD for about 12 years, because a lot of the work has already been done. We are having conversations with school, as you had, they have a school of nursing, and to see how do we loop them in. We were not able to do that within the short time duration. I have with that, yeah. So these are contacts. We'll be very happy to have conversations on support, on to share more. Myself, as well as we have a country representative who did a lot of work here, being based in partly in Gulu at Radachor, called Tadio Wandera, who I know is somewhere in the audience. I just want to
Okay, I think we're gonna wrap up. But Benson and Elisabetta, thank you both so much for sharing your project. We're really excited about it, and personally, and another e-learning project always excites me. So we'll get to some questions towards the end, but I'd love to introduce our next project here, our 6th project entitled Better Innovative Solutions and Informatic Leadership. This is Color. I'm not entirely sure how we say that, but you'll tell us. NGO and Afra Record. So your project, friends, eases the collection of clinical digital data through user-friendly technologies in remote and rural contexts in Kenya. And Angelo and Hani, I will turn it over to you to tell us more.
Thank you so much. Name is Color NGO, and this is Angelo Moratti. I am the desk officer, and here with me we have Heni from Afia Record, which is the innovator of the project. Color is an Italian NGO from Vercelli. We are born in 2002, and we work mainly in 3 different sectors: health, climate and earth, and education, and in different areas of the world, mainly Sub-Saharan Africa, Italy, and West Balkans. The innovator of the project was Afia Record, which is a digital health platform whose aim is to prompt patients to become more engaged in their health and take positive action to improve it. Also, we had a local partner in Kenya, which is the Ursuline Sisters of Mary Immaculate, a congregation born in Italy that are operating in Kenya since 2003, mainly to help marginalized people and promote quality education and provide medical care. As said, the target country was Kenya, mainly in 3 countries, Meru County, Tharaka Nithi County, and Kajiado County. We involved 3 different healthcare facilities with the aim of providing them with digital tools and innovation. Those structures assist around 10,000 people every year, and one of the 3 countries was completely new and born thanks to the project. The point from which we start is that in Kenya, access to medical care is not equally distributed, and there are some lacks in the infrastructure for clinical data that represents a real impediment to treatment in many cases. And also, the health services are concentrated in urban centers, and many people have to travel long distances to reach the nearest health center. And the lack for clinical data makes often impossible to correctly carry out diagnosis, treatment, and prevention for medical officers. So we adopted mainly 4 different challenges to address these problems that are limiting health development and well-being, which are the lack of health facilities, the absence of communication between health facilities each other, communication of clinical data, the inadequate infrastructure for clinical data inside the health facilities, and the lack of digitalization. And lastly, the absence of communication, not only between health facilities themselves, but also between health facilities and their patients. So I give the word to Henny to explain the solution and the main innovative elements of the project.
Yeah, sure. From the solution point of view, we really wanted to make sure that we start by digitizing the healthcare facilities, because with the relevant data which is currently operating in paper-based, they cannot analyze, they cannot make proper right decisions in terms of what illnesses affect which demographic and what type of medication are they in need of. So we started off from that point of taking on the exercise of digitizing the healthcare ecosystem. So the health facility, from the moment a patient walks into that hospital to the moment they walk out, and even beyond, everything is digitized. So we have multiple access channel and different platforms that they can use to capture and store, including different devices. So we also wanted to make sure that we all know the future of healthcare is personalized health treatment. So we wanted to make sure that we are fostering that by making sure that patients are not seen as clients or customers, but rather as active participants in the healthcare treatment. And I will elaborate more in terms of how we have managed to do that successfully. And we also wanted to make sure that we strengthen communication between the patients, but also and their facility, but also between different two facilities. So all the facilities that were piloted during this project have been able to communicate with one another and get an assistance. For example, if they have a complex case, they can engage the other facility or doctor in order to support them. We also wanted to make sure the solution is very scalable and sustainable. So we adapted a very dynamic pricing models, and we also made sure that the solution can be able to be accessed across different devices, whether online and both offline. In terms of the innovating solution, I mentioned that we do have quite interesting, and we are moving towards making sure patients are active participants rather than just patients who receive treatment. So we built a mobile application and even a USSD platform where patients without internet connectivity can be able to access the services. So we integrated telehealth, for example. They can be able to request for video calls from wherever they are, but also they can track their symptoms so that their patients can offer them the best treatment, but also gamification through reminders and paid surveys. So now patients are coming back to the platform, downloading it and being participants. They care more about what's happening with their health. Next. From the hospital point of view, what we have is a web-based platform that can be accessed using either browser, both online and offline. And basically, it's a complete hospital management system. It's able to manage how patients, from the moment they walk in to the moment they walk out of the hospital. They can integrate with different other devices and equipment, radiology, diagnostic devices and such. We have a pharmacy management tool, but the most important bit is that we use data within the system, every action points, to be able to advise the decision maker, the administrator of the hospital, what's going on in their health facilities. So that's the main difference in terms of how this project has been very impactful. Thank you.
Thank you so much, Henny. About the main impact and results that we reached, thank you to the project. As said, we involved 3 health structures, 2 already running and 1 new structure, and we consider this a pilot project to involve more structures in the future. Also, we had the opportunity to train 26 healthcare professionals, including doctors, medicals, nurses, laboratory technicians, and staff and receptionists. And also, we engaged around 6,000 patients in their treatment through training session and informative session for the communities that were involved in the project. As I said, scalability and replicability is really an important goal for us. So the basis to scale up this pilot project has already been set. In particular, Color and Afiarecord had meetings and agreements with the governors of two counties in Kenya, Meru County and Tharaka Nithi County, that are really interested in testing the solution into their own health facilities, public facilities, hospitals, dispensaries, because the three facilities of the project were private, were run by congregation of sisters, but the governments of the counties are very interested to test this solution in the public facilities because they recognize that it can be very useful for them, and also to address problems that they face every day. So in the next month, we have the possibility to scale up and test the solution in 8 public health facilities and hospitals. We have here our contacts, and thank you very much for your attention. We are available for answering questions later. Thank you.
Angelo and Hani, thank you both so much for a fantastic presentation and sharing with us. So we have one more presentation to hear from. That is the team focused on improving evidence-based management of hospital health services in Uganda. This is Medici con l'Africa, CUAMM, and Digital Health Uganda. William and Chiara, we are thrilled to have you join us. So over to you for your presentation, okay?
Thank you. Thank you to all. Thank you very much. We are very glad to be here. I'm Chiara Conti, desk officer for the projects of Doctors with Africa CUAM, and I'm here with my colleague William Waswa from Digital Health Uganda. Just one moment to share. So our partnership, and thanks to this initiative, was done by Doctors with Africa CUAM, which is an Italian-based NGO, founded in 1950 and now actually operating in 8 countries in Africa. Among these, there is our target country, which is Uganda. CUAM operates mainly in the framework of long-term development initiatives through health cooperation projects, through training of human resources for health, scientific studies and operational research on major health problems affecting African countries. And in Uganda has been operating since 1958 with an approach which was selected, which is the health system strengthening approach. I ask William to introduce himself and Digital Health Uganda, our partners in this initiative.
Yeah, thank you so much, Chiara, and thank you so much. I'm happy to be here. I'm called William Waswa from Uganda, CEO and co-founder of Digital Health Uganda. So Digital Health Uganda is a digital health startup in Uganda that's championing the delivery of digital health in hard-to-reach areas. So next slide. Thank you.
Yes, we implemented our project together with a local partner, which is St. John 23rd Hospital in Aber, which is a hospital with usually, like we have data from 2022, has an inpatients admissions of around 11,000 people and outpatients of around 42,000, with more than 200 of staff working in it, and it is located in the Lango region, Oyam district in Uganda. It is a private not-for-profit hospital, and it has a catchment area of around 450,000 people, because it is also a referral center for the nearby counties. What we selected as a challenge to adopt was to collect and organize clinical data, because as already was discussed deeply also before our intervention, is that developing countries such as Uganda continue to face numerous challenges in planning the access and the provision of healthcare and the required reporting. And when we speak of required reporting, we speak especially not only at regional level, but as well at national and international level. So the premise was that existing weaknesses in the health facility management and the administration, we realized that it jeopardized really the quality as well of healthcare service delivery, the required reporting, as said, and the effective utilization of healthcare services by the community. That's why we analyzed the situation, and we found, we tried to find a solution together with our partner Digital Health Uganda, for which I asked William to go into deepen the details of what was done, of the solution found, the results achieved till now. Thank you, William.
Yeah, sure. Thank you so much. So with our partners, QAM and the hospital, we realized available technologies and digital health initiatives, and also the current system that's being used at the hospital. We observed that there were really limitations with the interoperability of these systems with other institutions and also with other systems. Also, most of these systems were not providing adequate disease management capability. So to be able to provide full custom support for a specific disease like cancer or HIV or diabetes. So we also observed that most of the systems available, and also the available system at the hospital, it was an incomplete suite with some or many of the functionalities not functioning. For example, pharmacy, human resource, telemedicine. So ideally the system did not have these core modules which were deemed needed by the hospital. We also observed that there are a number of open source technologies that are available. However, they had limitations with it being using old technology. So what we did was to come up with our solution, which is called the Next-Gen HIMSS. So Next-Gen HIMSS is actually the next generation hospital information management system. And its aim is to improve healthcare service delivery in Uganda by streamlining the patient's clinical data collection and organization, considering the different disease clinical management workflow and simultaneous presence of different databases. So how unique our solution is, next slide. So our solution provides a complete platform that supports interoperability, so it can communicate with other systems and other equipment. It has core modules for disease management. For example, you can switch to a more comprehensive cancer management, HIV or non-communicable disease management. It's also a complete suite with inventory, telemedicine, pharmacy, all in one suite. And it also uses up-to-date technology. So it uses a lot of machine learning and data science to make a lot of clinical decision support from the insights. And it can also be developed to really fit into the local clinical workflow. We also provide support and customization for 24/7. So how our solution is very innovative. Next slide. So like I've said that the Next-Gen HIMSS is modular. It has a number of modules, but these can be deployed based on the health center's needs. It is integrative, so it can communicate with other systems, and it's also easy to use with support for disease management. For example, you can see here, you can switch the module to oncology into antenatal care, so it provides really a complete flow. It provides telemedicine support and also a comprehensive pharmacy, finance, human resource, lab management, and also medical equipment management, which are not readily available in a number of available technologies or tools. Next slide. So how innovative our solution is, for example, we said it is scalable and integrated hospital solution that really automates the whole hospital workflow. It manages administrative part, including human resource, pharmacy, procurement, inventory, but it's also used for medical, legal, and financial control. The platform has unique and tractable user interface design that we have really developed using user-centered design approach with end users to come up with interfaces that can easily be used by the healthcare workers. And we also assured of 24/7 support with critical maintenance plans. Next slide. So our results great. Currently, we have really developed a clinical and administrative workflow for the hospital and for the software. So ideally, this can inform more and further upgrades for the system. We have also compiled and carried out a comprehensive ICT assessment for the hospital, and then we do have an ICT assessment report, which really guided our procurement or deployment of our ICT infrastructure, but can also support scaling of our solution into the hospital. So we have also developed a procurement design and the technology to improve the hospital information management. We have also developed a digital security plan for the hospital, since the ultimate aim of the hospital is to also go live and online so that you can be able to support telemedicine. So you have really hoped to come up with a security plan and also organize or prepare the hospital to be able to shift from paperwork to local host, but also to online. We have also done training of clinical and administrative users for the system, and also this has been very, very helpful. So with what we have so far achieved, we really have an adaptable digital framework for next-gen HIMSS, and we assure that if you want to rescale our program that can really support the future project, CEOs and innovator partnership that can really support the scaling of the platform. So in terms of scalability, the solution components are cloud-based, based on software as a service, so you can really add more hospitals on the platform without really having to do a lot of deployment. It also supports full-time scale referral system from the point somebody has come into the hospital and also into another hospital. We really keep track of a complete full-scale referral. So in terms of replicability, it's an assessment of the pilot as really informs that next-gen HIMSS is deployable within other health facilities, wards, and units. So the system can be used in different wards, but also it can be used in other units. So it has a full-fledged support for nationwide implementation structure, since we have really worked with experts from the Ministry of Health and also with guidance on the HL7 reports. So in terms of sustainability, we really hope and plan to have a partnership with the CSO to see that we can really have the project extended beyond the pilot. Thank you.
Thank you both so much. So now I'm going to invite all of our esteemed presenters to join me on the stage. We'll see many little video screens. That is great, all coming together. So we only have a few minutes, which means I want to try and ask questions, but we are going to have to keep our answers as short as possible. And I think what I want to do is start with you all at AFIA and Color NGO. I'm really interested to learn a bit more about how you manage the security and privacy risks of your clinical data. How do you keep people safe? How do you guarantee that privacy and security data is well managed when you're working with a vulnerable population? This is a topic on a lot of people's minds these days. Any thoughts there, Hani?
Yeah, sure. Actually, yes. From day one, I think even as after record, we realized that the biggest challenge for us will be security, because once we are compromised, we'll instantly die. So we've invested quite a lot. One of our, interesting enough, one of our investor is founder of one of the founder for Cardano. So we actually built our platform on the blockchain technology. It's quite expensive, but we're lucky that we are getting a lot of support, the developers, the expertise, everything at a very subsidized rate, simply because of the investors. So it was quite a strategic, but also other than that, we've also managed to make sure that we have two-factor authenticator. The system automatically logs out a hospital worker if they're not active. So we are highly permission driven. So for example, a receptionist only sees what they have to do. And the best part is that we've given access right and ownership of that data also back to the patient. So patients can determine and dictate that, you know what, as a patient, I want this medical profession to see my data or not. They can easily revoke access and such.
Thank you so much, Hani. And a reminder to folks who are watching, if you do have questions for our esteemed presenters here, you can ask them in the Q&A section of the chat, and you can go to the Expo section of the site and you can go deeper, learn more about each of these projects, and connect with them directly. So I'm being told by our team here that we have time for one last question to the final group. Let's see here. So I'm interested to ask about interoperability to the CUAMM group. Do you face the challenge of interoperability of the next gen NHMIS solution with other information systems, including the most well-known and famous one, DHIS2? And if so, how are you dealing? I know you talked a little bit about this in your presentation, but how do you deal with those challenges?
Yeah, sure.
Maybe
Thank
that's
you
a
so
William
much.
question.
Yeah, sure. Thank you so much. Actually, the good example is DHIS2. I think, sorry, DHIS2 has been developed on open standards, on HL7 that are compliant. So for systems like DHIS2 that have been developed using these standards, interoperability is not a big issue. However, there are some systems that have not been developed using some of these standards, and that's why we are really having issues with communicating with some of these systems, including some of systems that are being used, especially the lab management systems that are available in a number of hospitals have not been developed on these open standards. So connecting or porting to this is a challenge, but for some systems like DHIS2, interoperability is achieved.
Thanks so much, William. So again, I think what I would suggest again for our esteemed panelists here to, if you're watching this, a recorded version or live, to connect with them on their one-pagers in the Expo section. And I think with that, we will probably have to move on and introduce our final keynote speaker here. So let me pull up my outline, but I am very excited to introduce Louise Auersnap. She is the head of WHO's Innovation Lab and the Department of Digital Health Innovation within WHO. Louise, we are thrilled to have you join us. You are an innovation and change management leader with extensive experience and knowledge in global health. What a fascinating job. You have worked over 20 years at the UN, the private sector, government, NGOs, and academia. And you're currently at this fascinating thing we call the Innovation Hub at WHO. So I'm excited personally to learn more about that from you. And we're thrilled to have you here today speaking with us. Louise, over to you.
Thank you, Nick. And pleasure to be here. And it's been exciting to listen in on all these fantastic examples of innovation. So kudos to everyone for the great work. I'm pleased to deliver a final keynote. I hope everyone's still awake and energized. So let me go ahead. So ladies and gentlemen, esteemed guests and fellow innovators, it's an honor to be here today at the Coopen Summit 2023 to discuss the critical role of innovation in achieving our shared vision of a world where everyone can live healthy, productive lives. At the World Health Organization, our mission is to ensure health for all, regardless of who they are or where they live. Unfortunately, progress towards this aspiration, as articulated in the Sustainable Development Goals and WHO's triple billion targets, is lacking. We're moving at a quarter of the pace needed to reach these goals by 2030. This is unacceptable, and we need to do more to accelerate progress. So why do we find innovation important, and what is it? Innovation in health represents a significant opportunity to get back on track and make meaningful progress towards our shared vision. Now, let me delve into what we define innovation to be, given how liberally that term is used in global health, often reduced to describing shiny technology gadgets and big game-changing inventions, while the reality is that there is a spectrum of other kinds of innovation that deserves attention as well. At the WHO Innovation Hub, we see innovation in health as any new or improved solution in a given context that responds to a public health need and that has the ability to accelerate and sustain positive health impact. Let me elaborate on a few key points here. Firstly, innovations of all flavors should be considered as we aim to save and improve more lives faster and better, reach the unreached, and stop the gaps that unfortunately exist in our imperfect world despite the best technologies, programs, systems, and intentions. Innovations span across health system needs and can broadly fall into three categories: digital innovation, service delivery innovation, and health product innovation. Secondly, the novelty aspect of innovation is context-specific. In other words, innovation means health service components or practices that are new or perceived as new in a particular program or geographic context. For example, we supported the leadership of the Ministry of Health and WHO's country office in Somalia in the installation of solar-powered primary healthcare clinics, including life-saving oxygen concentrators, working closely with partners and innovation funders, such as Grand Challenges Canada and others. The respective parts of this innovation, the solar panels, the power banks, and the oxygen concentrators, are not innovations any longer in Switzerland and many other places. However, in the fragile and insecure context of Somalia, where electricity relies on expensive, polluting, and unreliable diesel generators, the combination of these technologies represent an innovation. It provides a fast, affordable stopgap solution that has saved hundreds of lives, including of newborns with pneumonia who would otherwise have died. Such solutions can help save lives, as well as the environment and healthcare cost, while we make progress on building climate resilient and sustainable healthcare systems. Thirdly, sustaining innovation requires a systems approach. An innovation does not sustain or scale in isolation. It requires a set of interventions, including the processes necessary to build sustainable implementation capacities and broader programs around it. For example, together with the WHO technical department responsible for mental health, we're supporting the WHO country office and Ministry of Health in Zimbabwe in scaling up a social innovation in health called the Friendship Bench, which trains grandmothers and community health workers in administering cognitive behavioral therapy from physical benches placed outside health facilities. By supporting the government in designing it, not as a single intervention, but as part of a wider government-led national mental health program, a more sustainable and scaled solution is built. We need more of that at scale globally. And we need innovations and innovators to orient the energy towards the biggest public health pain points and the gaps that exist to make sure no one is left behind. Lastly, the lifespan of an innovation is fraught with challenges. We've all heard of the valley of death, where promising technologies or other innovations get stuck and often die in their early stage for lack of adequate resources at a critical moment of market entry and adoption. A possible underlying aspect that may lead to an innovation's demise, which is perhaps less discussed, is whether it addresses a real significant demand, not to speak of the big pain points in the public sphere. For those innovations that do make it to a certain level of implementation at mid-stage, they often run into another barrier, which we at WHO call the wall of frustration. This is where the innovation's broader adoption in a market and or by the public sector fails to reach large scale in population and or geographic reach. Consequently, the innovation's availability, affordability, and accessibility to the people who need it the most is limited. I highlight the uptake of innovation in health by the public sector as this represents an important and to some extent untapped opportunity for governments to seize. Historically, and with too little credit and PR, governments have funded large-scale research and development that have generated some of the most critical and game-changing innovations to date. For example, public investments were critical in the creation of the internet, renewable energy technologies like wind, solar, and geothermal power, as well as the Human Genome Project, which has had a significant impact on fields like medicine and biotechnology, and has led to the development of new treatments and therapies for genetic diseases. Governments globally can seize this opportunity, embrace this role even further, and generate more health and well-being in their populations if they systematically support innovations from ideation to scale. And we at the WHO are here to help. At the WHO Innovation Hub, with thanks to our organization's global reach and technical leadership, we can help address the above barriers to scale in at least two ways. By supporting the shaping and prioritization of the demand for innovation as we highlight the big public health pain points, as well as the gaps that require innovation. And by diagnosing and facilitating the unblocking of scale-up barriers in the public sector through capacity building, de-risking the public sector's engagement with innovation, and in facilitating financing of the transition to scale process. Our mission at the WHO Innovation Hub is to support WHO member states to accelerate impact of evidence-based interventions through scaling of innovations. We do this by working closely with our WHO colleagues at the regional and country level in 4 strategic pillars of work. First, in curating action platforms, we use our data and evidence-based approach to curate the health demand areas, thereby communicating to the innovators and innovation funders of the world that if you wish to solve problems and have a positive impact in people's lives, if you want to reach the neglected populations and address the neglected problems, here's where you should focus. We also help curate, aggregate, and demonstrate existing proven solutions by facilitating technical assessment of innovations with a view to creating a supply pipeline of proven assessed innovations, thus de-risking and reducing the complexity of navigating the vast landscape of innovations. Second, in codifying products, we apply our normative leadership in setting norms and standards and making guidelines on how to accelerate impact through scaling of innovations. This will over time provide WHO's member states and other stakeholders with the necessary guidance on topics such as how to overcome barriers to scaling innovations, including financial, regulatory, cultural barriers to implementing innovations at scale, or how to create a thriving national ecosystem for innovation. Thirdly, we capacitate stakeholders through trainings to have the up-to-date skills and knowledge that will enable them to confidently and safely manage and scale innovations for the public good. Lastly, we catalyze ecosystems for innovation by convening stakeholders and facilitating global partnerships and supporting the development of the required governance and policies for innovation to serve the public good. Talking about convening stakeholders, I'm pleased to pause here to announce that in collaboration with our WHO Collaborating Center, the Kalam Institute for Health Technology in Vizag in India, we're organizing a landmark World Health Innovation Forum from 14 to 16 November 2023 in India, which will be the world's first global showcasing of government-led innovation work and results, providing a unique opportunity for peer-to-peer learning across public sector actors from around the world and for fostering collaboration across multiple stakeholders, including innovation funders, private sector entities, and innovators. So please save the date, 14 to 16 November of this year. In closing, innovation is critical in today's world for all of the above reasons. And because, above all, innovation exudes hope. It exudes agency. It exudes optimism grounded in science and creativity. With our capacity to innovate and transform the way things are done, we empower ourselves and each other to create a better world and ensure health for all. We free ourselves from the false sense of determinism that makes us think that there's nothing we can do to slow down and stop climate change, that makes us think that we cannot prevent the next pandemic, that we cannot do much to bring down the number of women that die while giving birth. With innovation and science, we can. Thank you.
Thank you so much, Luis. Thank you deeply for these great remarks. Really incredible to hear your insights on the anatomy of innovation, all the work that WHO as an institution is doing on innovation and health, from seeding much needed government partnerships and collaboration to supporting the scale up through overcoming all kinds of financial and regulatory barriers for innovation initiatives, emphasizing the importance of capacity building, something very near and dear to my heart. And then, of course, this like bigger idea of catalyzing ecosystems and convening stakeholders. You truly are, as an organization, doing so much in this space to make so much happen. So we thank you, Luis, for sharing your time with us. And friends, I hope you enjoyed today. What a rich and full program we had. That dynamic roundtable to kick things off, 2 fascinating keynotes from John Paul and Luis, 7 amazing projects covering all kinds of innovations across the continent of Africa. Again, a big thank you to the foundations, the Cariplo Factory, JengaLab, everyone who worked so hard and tirelessly in making today's event possible. And a reminder that the learning and the exchange does not have to stop here. Would highly encourage folks who are joining to keep these conversations going, whether it's on the platform here with Hopin or on LinkedIn. You have many ways to reach out and connect with the variety of incredible panelists we had speaking today. So a final note of generosity. Thank you, friends. Looking forward to going deeper with you in the weeks to come. And that's it from us. Thank you again, and signing off.